Hi, I'm Brandon Leonard with Men's Health Network, and I'm here in Washington, D.C. at the Dialogue on Men's Health series discussing strategies and initiatives to improve men's and boys' health across the lifespan. And today I'm speaking with Kenn Harris, who is Project Director for the New Haven Healthy Start in New Haven, Connecticut, and he's also President-elect of the National Healthy Start Association. So thank you for joining us.
You're welcome.
To get started, I'm going to ask you, how does the National Healthy Start Association view fatherhood, and why?
Simply, we view it across the life course. And so for us, that's before, during, after, and beyond pregnancy. And along that life course, men's health is critical at every stage, because if he's not healthy, then he can't really fulfill roles and responsibility across the life course. So we view it as before, during, and after. That way we identify what can be done preconceptually, what can be done during like prenatal phase, what's done during the pregnancy, how he can support her. You can begin to identify specific roles and responsibility he plays along that continuum. And then after, you talk about really how parenting goes right into parenting and really assuring that he is involved along the life course so that you can give the child the best start going into the early years, which then again the continuum continues. So yeah, before, during, and after, and beyond, for the reasons of securing not only the child's health and well-being, but also his as well as the mother of the child.
So why is men's health such a critical component of the work that you do with Healthy Start?
Not only the work that we're doing with Healthy Start around fatherhood, but I think for the nation. So men's health has been ignored in this country, especially for poor men, men of color, for such a long time that we're inviting him to the table and to this work around women and children, and he's not healthy. So men's health for us is physical, it's mental health, and it's behavioral health, even spiritual health. And so these have been long neglected for men, especially poor men. So it's really become a critical issue for us and ensure that he's healthy. So when he comes to the table, for example, if he has issues around violence, that needs to be addressed prior to him really being positive, having a positive impact on this family. And so his health is critical. And also thinking about the chronic diseases that plague men of color, unaddressed issues, how they can show up along the way. Even when you think about sexual behavior. So again, health practices, health lifestyle, all of these become critical. And again, men have not been engaged around their health for such a long time. And so it's really critical. And also we find that from working with men in our work that there's a sense men have this feeling of inadequacy that's really stems from, that impacts their sense of responsibility along the continuum. So again, it's been that neglect of health, not taking care of himself, so he doesn't know it's important. So really helping him understand the value of his health and his impact on those around him, particularly the mother of his child and the child itself. So it's really critical for us.
What do you think makes the National Healthy Start Association a leader in male involvement in fatherhood?
Yeah, so Healthy Start has been around since 1991, and as you know, it began as a community initiative focusing on maternal and child health. It's a maternal and child health initiative. So it was never focused on fathers, and we know the system hasn't been created for fathers. So when it's titled maternal and child health. So Healthy Start, when it started, didn't have the luxury of ignoring the fathers because they actually were showing up at clinics. They were showing up in our communities. So many of the Healthy Starts start doing work with men, and there were several successful male involvement fatherhood programs that were really born out of that work. And so we've really been doing fatherhood since 1991. So well over 22 years of work. And we have developed, I think, promising practice that's really risen to be model programs. And we also have seen a lot of practice that's promising that we're working to really assure that become model programs. And so because we have that experience, in addition to today we have 105 sites across the country, and they represent urban, rural, tribal, as well as border sites. And so we have an opportunity to work with so many different populations of men, and I do believe that out of that work it can really inform needed new research in the future from African Americans, low-income men, Mexican men, Native American men, Alaskan population. So we've got it all, so I think we're pretty unique in that regard.
Can you talk about some of the partnerships that have been critical to your work?
Yeah, it's really important, I think, when you're doing fatherhood work or male involvement, is to work with health entities and organizations, like health centers, for example, because they're in the community. And if there's a place where men can go to get health, we find that health centers are a place in communities where people feel comfortable. So if you can begin working with health centers, for example. I also think that with the limited resources available for fatherhood work now, it's important that agencies are partnering with any agency in their community that does any work with men. We're talking about job readiness programs, working with schools around education. So there's a need to partner with all of those agencies that really interact with families, because he has been excluded from all kinds of systems, and that is why including him and acknowledging him in those systems is important. So the partnerships become important because no one agency can meet all of his needs, and so I may be able to meet 2 of your 5 needs, and if I have a partner that can address the others, then that's what makes a successful program, working together. And I think addressing fatherhood is not just a one agency deal, it's really all of us. And when you think of that kind of social ecological model, it's about the partnerships. All of us together can help these families.
Can you tell me a bit more about preconception care and what we can do and what you're doing to reach men and talk to them about their health really before they have children?
Yeah, so we distinguish, when we're working with men, we distinguish preconception care with preconception health care. And so, because that term preconception is so associated with women's health. I mean, who talks to a man about preconception? And then also reproductive life planning. But when we talk about preconception health, it really gets into this conversation around health and lifestyle. And that's where we begin to engage men and talking about how their health can impact the health of their partner. And just looking at the statistics on sexually transmitted infections and diseases, that's one way of entering that conversation. Conversations around tobacco use. So that, again, that's a way to enter that door of speaking about preconception. Looking at risk factors for chronic disease, for example. Again, talking about preconception focuses on your health status, and so that's where we kind of begin to explore the kinds of issues that men need to address around their health in preparation for pregnancy. So those conversations come up before you get pregnant. And then when we focus on reproductive life planning during that time, then it's also planning for pregnancy, or planning to not get pregnant, and what we can do as men to avoid that situation.
What are some of the most effective strategies that you've seen or that you've used to engage men in their own health and the health of their families?
Yeah, what we find with doing programs, and we've seen this across the country, support groups work. So we do one-on-one work with men, but connecting them to a support group where they're talking to other men about their health, and they begin to share ideas on what they do. And so out of those sessions, you kind of come up with new ideas to approach men around their health. But I would say one of the most successful things that happened, wasn't planned, was what happens when men do get together. So support groups, and that's an element that we encourage our fatherhood sites across the country to have. Create a place and space for men to come to talk about their health, to talk about accessing health, because that's where you discover issues. I don't have insurance. I don't have a job. Systems that push men out, or they push them under. So many men are what we call underground. So they don't access health because there's a risk. If they know I'm around, then they're going to get child support or whatever. So those groups are the great place to get information about their health, how they access health, and then how we can help them. And I think the movement of fatherhood in this country has advanced a lot. But I hope as we move forward, we avoid duplication. We really build off of the work we've done with women, poor families for years now, with women and children, really building off of that work. And so with that in mind, we'll move faster and not slower. So that's my hope always with this work, that it's more than just a movement. We really transform systems, which really means that we have to change how people think about fathers, men, poor men in this country, which right now it's still not favorable in 2014, but we have to change that.
Okay. Thank you so much for taking the time to talk with me.
No problem. Thank you for having me.